Hello and hi, I am Dr. Zaman and I am going to teach you how to prepare yourself for the OET writing section. For this, you need to have these notes of future land. These notes are available everywhere on social media pages and in WhatsApp group. Even you can download it online. This is the OET writing template available present on the page number 10 of this future land book. What you need to do is just go through this template. How to write the address of a consultant whom you are referring the patient, the introduction, the body, and in between the visits, the final visit and the conclusion. Always practice the address, introduction, and conclusion first. Try to speed up your writing speed and these three sections. You can easily write the address, the intro, and the conclusion in about 2.5 minutes to 3 minutes. It will save the remaining minutes for the body, which include your social history and medical history of the patient, the visits and the follow-up visits, and the final conclusion. If you spend a lot of time in writing the introduction, address of the patient, then you won't have the time for the later parts of the letter. Remember, practice the address, introduction, and conclusion. First, check your time speed and how much time you are writing this. The next step is go to the Future Land book, page number 91 to 140. Read these 50 pages very carefully and read it again. Read it twice or thrice. These pages contain all the grammar that will help you in writing the referral letter and discharge letter, and it will help you in gaining a good score. Please read these carefully and learn this grammar, where to put the article, where to put the comma. The next step after this is go to the OET website. For every specialty there are 5 sample paper for each specialty, like for doctors, 5 sample for nursing, 5 for physiotherapists, and so on. Remember, out of those 5 practice paper, just practice 2 and leave the remaining 3 as such. Do not open the remaining 3 papers. Practice 2 paper and check it with the official referral letter. Work on your weaknesses. Again, if you haven't put the right words, haven't used the article or comma, go back to the grammar pages from 91 to 140 and practice on your weaknesses. Improve your weakness. Go back again to the OET website and practice the paper number 3. If you have slightly improved, it means you are going on the right direction. Then again practice 3 papers of Kaplan, available online and on different pages on social media. After practicing the 3 sample paper of Kaplan, again reassess yourself. Have you made any improvement or not? After Kaplan, go to the Future Land book, page number 140 and onward. There you will see papers previously practiced and checked by the one of the institute called Benchmark Education, who usually check your papers while practicing. They are paid, so there are so many papers available who has been practiced and checked. You can compare your writing with those papers. These are very helpful. As your preparation is going on, the time will become, as your preparation is going on, you will be left with a very few days just before your exam. What you need to do in those days, reassess yourself and go and practice sample number 4 and 5 just before your exam. If you are left with 2 days, practice sample paper 4 and just one day before your exam, practice paper number 5. Now, how to approach to the writing paper, to the writing a referral letter, I'm going to show you that in the next slide. The technique for that is, now you will be given this sort of paper, an exam. Okay, what you need to do initially is to go directly to the writing task using the information, and this case notes. Write a referral letter. Identify this letter whether this is a referral or discharge for further investigation and definitive diagnosis to the gastroenterologist. It's mean you are writing a referral letter for investigation and definitive diagnosis. Where is the definitive diagnosis? That is written in the final visit. Okay, this is the final visit of the patient. This is the final visit of the patient, and they have mentioned the provisional diagnosis: gastroesophageal reflux plus minus stricture. So you will write a referral letter. Okay, as I have shown you the template, go initially there how to write the introduction for a referral letter. Now, after reading this referral letter, and you are knowing now that you are writing a referral letter to a gastroenterologist and the patient is having a diagnosis of gastroesophageal reflux, go to page number, the first page, and this the detail of a patient is given. Social history: she is a teacher. She is a teacher and she is divorced. Remember, the teacher is divorced, so this means she is going under the mental stress. So this is important to write, that a divorced teacher. Mention this. She does not smoke. Leave this. Don't mention this and the referral letter writing. Okay, the things which are negative, skip those, otherwise your letter will become more than 200 words and this will affect your score. She is a social drinker, you can mention this. Now, family history of hypertension and asthmatic father. Mother is hypertensive and asthmatic. Hypertension and asthma does not have any link or correlation with the gastroesophageal reflux disease, so do not mention these. Father has peptic ulcer, mention this. Okay, maternal grandmother died of heart attack, do not mention this. Maternal grandmother died of asthma. These factors does not correlate with the peptic ulcer, so skip these. You can mention this peptic ulcer. Previous history, you can mention this, that she has the childhood asthma for which she might have used a steroid, and the other history, I don't think so anything that is very significant apart from the use of topical steroids. So what I mean from these, always look for your task and make your provisional diagnosis and work on your diagnosis that has been given to you, whether the social history or anything in the past history that is related to the disease. Directly mention those in the letter. The not relevant things, skip those completely and do not mention those in the letter. Otherwise it will increase your writing word from 200 to above. So this is very simple technique, and always remember, go to the writing template. First practice the intro, the address, then the intro, for a referral letter, and write a conclusion. Practice these whenever you sit and the exam. Write the address, intro, and read these. Okay, read these and start your body of the letter. Thank you so much. If you like this video and if you think this has really helped you, please like and subscribe to my channel. Thank you.